verify my order for an arterial blood draw. Hand hygiene. How are you doing today?
Good.
Good. My name's Catherine. I'm your nurse. Before we get started, can I just verify your name and date of birth?
Yeah, it's Chuck Morris, August 21st, 19XX.
Awesome. That matches perfect. And do you have any allergies?
No.
Okay. So for today, we're going to be doing an arterial blood draw. Have you had one of those before?
Yeah.
Good. So you know the procedure a little bit.
Mm-hmm.
So we're going to draw first back some waste and then get rid of that, and then we'll draw back the blood for your lab. And we're going to make sure that we keep the port really sterile, so I'll just have you stay super still during the procedure so we don't get any contaminants towards the port. Do you have any questions about it before we get started?
No.
Sounds good. So I'm going to turn the cardiac monitor off so the alarms don't go off. And I'll wash my hands and gather my supplies. 2 syringes, gloves, gauze. Okay, so I'm gonna assess the IV site before we get started. Looks no redness, no swelling, no drainage, looks good. It's patent, flush as well. Okay. Put my gloves on. I'm gonna take the cap off. We want to keep it really sterile. So if it got contaminated at all, we just go get a new one. We'll go ahead and attach our waste. Okay. And we're going to draw back 3 to 5 milliliters of blood for our waste. That's about 4, so that'll be perfect. Okay, and then we'll make sure we throw that one away in the biohazards. Then we'll get our next one. Okay, and we'll draw back however much is necessary for the lab we have today. And then we'll put that aside to send to the labs, and we won't mix those up. Then we're going to flush the line, make sure it's all clear so it doesn't clot in there. And we'll make sure we keep it nice and sterile. So we'll first flush to the patient. Keep that there. And then we'll flush to the port. Perfect. Turn it off to the port. And then place the cap on there. And then clean up all of our supplies. How was the procedure for you, Chuck? Do you feel okay?
Yeah, I was good.
Good. Do you have any questions about it for me?
No.
Perfect. So I'll make sure your blood is lowest position, 2 side rails up, call lights in place. If you have any questions, just give me a call. And yeah, everything looks good. We'll see you later.
Thanks.
Good. I'll make sure the arterial waveform is back on the monitor, which it is, looks good. And then I'll go to document, and I'll document the patient's vital signs and oxygen before and after the procedure, and how they tolerated the procedure, their response. And then I'll document the location, status, and patency of the line, which they all looked good. And the location is on the right forearm. Yay.
Thank you.